Hey, everybody. I'm your host, Doc Bob Lee, and you're watching Open. It's that live interactive program that brings the Bronx and New York City straight to your TV set. You can stay connected to us through social media at BronxNet TV. Leading things off, our first guest is the director of Take Care and NYC Test and Trace Corps and the assistant vice president of ambulatory care for NYC Health Hospitals. And she joins us today to speak about the current state of COVID-19, COVID testing and tracing protocols, the impact of the vaccine, and new developments for Bronx residents to protect themselves and their families. Please welcome to the show, Dr. Amanda K. Johnson. Doctor, welcome to the show. Nice to see you again.
Dr. Lee, good to see you again too. Thank you for having me back.
Yeah, I mean, you've been making your rounds. I mean, on WBLS, on BronxNet. We see you all over the place. We see you on social media. So what's happening now? Please tell us about your current role first with the Test and Trace Corps.
Yeah, well, you stated it quite nicely. So I'm a primary care doctor who sees patients in Upper Manhattan and Harlem. And then I also serve as director of the Take Care pillar of the Test and Trace Corps. By now, I'm sure all your listeners know about the Test and Trace Corps. We are the city's community testing and contact tracing apparatus in response to the COVID-19 pandemic. And the program that I lead is called Take Care, and we're responsible for supporting people in isolation and quarantine. That is, when they've been diagnosed or exposed to COVID-19, we help them get what they need so that they can separate and not infect other people.
Okay, so now they rolled out the vaccine since the last time we spoke. You know, they were talking about it, but they're here now, and you got about 3 or 4 different companies doing it so far, and there's more to come. How does that impact what we're doing as far as testing?
Yeah, so I think when I was here last time, we were just on the tail of getting the vaccines approved and preparing to roll them out. And now they are here. And even as early as this week, we've been having an expansion in the people who are eligible for testing. So it's a really exciting time, and it means that we are busier than ever. That being said, COVID is still here. We're experiencing a high plateau in the number of cases. So it's still more than what we saw this past summer. And I don't want people to get too comfortable too quickly. It still remains vitally important that people are coming out to get tested, especially in the Bronx where you live. We have our Get Tested Tuesday this past week, and we had some additional testing opportunities for residents of the Bronx. And so it was a way for ensuring that testing remained accessible to all communities in New York City. We still want people to wear a mask when they go outside or when they're around people and they don't know their COVID status. This remains vitally important even after people get vaccinated, because we still don't have everybody vaccinated. We still want to make sure that people don't run the risk of transmitting the virus to other people, even if they are asymptomatic. Washing your hands remains vitally important, staying home if you're sick. And then we do want people to come out and get vaccinated when it is their turn. And happy to say a little bit more about that.
Yeah, please do. But you can still be asymptomatic even after you take the vaccine, because you can still get it and give it. Is that correct?
That would be the concern. And so that's why we're advising people to continue wearing masks even after they get the vaccination. You don't want to be a carrier who inadvertently gives it to your grandmother, your grandfather, especially some of the older adults in the community. Granted, they are eligible for vaccination. So we really want to support them in getting signed up and getting them vaccinated and protected. At the same time, you know, we know that they're some of the most vulnerable, and we wouldn't want them to be in a situation where they got really sick, had to go in the hospital, or have even worse things happen to them.
That's so important to understand, that you can still get it and give it. So it's still important to remember the 3 W's.
Wash your hands.
Watch your distance.
Wear a mask.
And wear a mask, yes. In any order people would like to do. But I always say mask, wear that mask, watch your distance, and wash your hands. It's so important. So tell us about the, during the testing, have you seen any different strains or variants? Or are you just...
Yeah.
Go ahead.
So one of the things that we are doing as we test people throughout New York City is we want to actually, at a molecular level, understand what strains of COVID-19 are circulating in our community and how the composition is changing over time. And so if you go onto the Department of Health webpage, you'll be able to see a breakdown of what variants we have running through New York City. It'll give you the code name, so B117 and things like that.
Sounds like
so
a bomber,
as we see that composition
B117.
change,
Yeah, sounds like a bomber, the B117 bomber or something like that. But still, that's why we need to protect ourselves. I'm sorry, go ahead.
Oh, not at all. But, the thing that we worry about with variants is we want to ensure that people get vaccinated, because if there's no human to infect, if the virus can't replicate, it can't mutate, and we won't have emergence of variant strains. What we want to prevent against at all costs is having a COVID-19 strain emerge that isn't responsive to the therapies right now, that is more transmissible, that confers a greater risk of injury or harm. And so right now we're in a race against time to ensure that we can protect people, get them immunized, get them protected against COVID-19 so that the virus doesn't have a place to replicate and an opportunity to mutate.
Yeah, and there's a report that came out a little while ago saying that Pfizer is claiming that it's 100% sure that it protects youngsters, school-age kids.
I saw that tweet come across as well. Yes. Yeah. So very excited to read that paper as well and get educated on it. Right now, our vaccinations are approved, finalized for up until the ages of 16 and 18, depending on which vaccination you're looking at. But can you imagine having something that we'd be able to offer school-age children by the time people are going back to school in the fall? That's a game changer.
Yeah. Now, a lot of people are traveling. What should they look out for? Should they get vaccinated before they travel, or what's the deal with that?
Yeah, so traveling is opening up. And I understand that people have toughed it out for a long time, and they're really itching to see their parents and see their other loved ones who may live in other states. That's me included. Still haven't seen my family in over a year.
Yeah.
If you do decide to travel, and this is a personal decision, we're not recommending that people get antsy and start making moves and taking risks that they wouldn't otherwise. It still is vitally important that you get tested before you go, you get tested before you come back, you get tested after you come back, and that you still monitor yourself for emergence of symptoms. Not every city is like New York City in terms of how vigilant people are about hand washing and mask wearing and obeying social distancing rules. So you're putting yourself at risk when you travel. When people are on planes, remember that is a bunch of air that's just recirculating. So continue to keep your mask on when you're in planes. Wash your hands. I know I sound like a broken record, but these are the things that we have to protect ourselves. Now, you mentioned vaccination and other things you can do to protect yourself before you go. Every New Yorker who is eligible, I implore you, I encourage you, I am happy to answer any questions that you might have or point you to reliable resources like the CDC or the Department of Health and Mental Hygiene. But please, I encourage you to get vaccinated. It is safe, it is effective. And as Dr. Lee mentioned at the top of the hour, we now have 3 different versions of the vaccine that will help prevent you from either getting COVID, or if you were to even contract COVID, prevent you from getting very sick and prevent you from having to go into the hospitalization, which is the thing that we all care about.
People ask different questions. Which one should I get? Should I get the Johnson & Johnson? Should I get the Moderna? Should I get the Pfizer? And now they got the AstraZeneca coming out. I think they proved that one too. But where do they go? What's the difference? Oh, do they all do the same thing?
So both the Moderna and the Pfizer vaccinations, that is an mRNA vaccine. So it uses a slightly different technology and it requires 2 doses, while the Johnson & Johnson vaccine is an adenovirus vaccine and only requires 1 dose. Both of them keep you from getting sick with COVID and from having to go to the hospital, and drastically reduces the eventuality of people dying from COVID. And so whatever vaccine is available at the site that you go to, I would recommend that you take it. They all are effective at preventing the outcome of people getting really sick and from passing away from COVID-19. The way that the vaccine distribution works is that certain sites will get a certain allocation of vaccine. So you might not be able to walk up, look at the menu and say, oh, I want this one, oh, I want that one. The allocation is controlled quite tightly. And so, we try to parcel out the vaccines so that they get to the places where they can be effectively administered, that we have the right type of storage, that we have the right type of staff, et cetera.
And it doesn't change your DNA or put a chip in you like some people speculate.
This is a very good question. There are no microchips in the vaccination, so it's not something that anyone's going to use to be monitoring you. And it is absolutely true that it does not affect your DNA. It does not affect your DNA. It does not affect the DNA of a child that you might be pregnant with. It doesn't affect your DNA that you're going to pass along to future children. It doesn't affect your fertility. All of these things I know have been floating out there, and I just want to make sure that people have access to the most accurate information possible. In fact, even with the vaccines, note that the particles that are in the vaccine and get into your body will dissolve them quite quickly. mRNA is meant to be dissolved by your body. It doesn't stick around for long at all.
Doc, anything we missed? Anything you want the public to know that we didn't ask?
So one other thing that I want to highlight, in addition to getting tested and getting vaccinated, is the availability of new treatments if you were to get infected with COVID. And this is a game changer. This is something that we didn't have a year ago. So if you are infected with COVID, you're early on in your course, you just developed symptoms in the past week or so, and you meet certain criteria, you're eligible for something called monoclonal antibody treatment. These are the medications that you can receive. It's a one-dose infusion, so medicine that you go to a clinic, they will put in an IV, you will get this medication, and it helps reduce the chance of people with mild to moderate cases of COVID from progressing to be severe cases of COVID, going into the hospital, getting really, really sick from it. This is an amazing opportunity available in New York City, and folks who are interested, means you've been diagnosed with COVID-19 and you're in about the first week of your symptoms, can call our COVID hotline. I know I've plugged this in the past, but I'm going to do it again. 212-COVID-19, and this time you want to press 9 to learn more about monoclonal antibody therapy. They'll talk to you about, whether you're eligible, how old you are, what chronic conditions you might have. But if you are 65 and older, that alone is one of the qualifications for this treatment. So definitely, if you're 65 or older and have been diagnosed with COVID, please give us a call at 212-COVID-19, press 9, and learn a little bit more about this treatment. We also encourage you to speak with your doctor to get more information about how to connect with this therapy, but you can also call the hotline and just bypass that and get more information and get connected.
Now, Doctor, you're a wealth of information, you know that, right? And we always appreciate your knowledge, and you're always welcome back. Thank you.
Thank you. Happy to serve. Want to make sure that everything we have to offer gets out to all New Yorkers, gets out to your listeners, Bob. We don't want anyone to be left behind in the fight against the pandemic. And I'm really so appreciative of you and of everything that people in the Bronx are doing so far to keep themselves safe and keep their communities and families safe. So thank you so much for having me again.
Thank you. Amanda K. Johnson, Senior Director of Care Models in the Office of Ambulatory Care for the NYC Health and Hospitals. We appreciate you, we thank you, and we love you. Thank you for your service. More Open on the way, coming up next.